The principle of constraint-induced therapy have been applied by a team headed by Dr. Friedemann Paul Vermeulen in Germany, which work with Taub to help stroke patients who have damage to Broca's area and have lost the ability to speak. About 40% of patients who have a left hemisphere stroke have this speech aphasia. Some, like Broca's famous aphasia patient Tan, can use only one word. Others have more words but are still severely limited. Some do better spontaneously or get some words back, but it has generally been thought that those who didn't improve within a year couldn't. What is the equivalent of putting a mitt on the mouth or a sling on speech? Patients with aphasia, like those with arm paralysis, tend to fall back on the equivalent of their good arm. They use gestures or draw pictures. If they can speak at all, they tend to say what is easiest over and over. The constraint imposed on aphasiacs is not physical, but it's just as real. A series of language rules. Since behavior must be shaped, these rules are introduced slowly. Patients play a therapeutic card game. 4 people play with 32 cards made up of 16 different pictures, 2 of each picture. A patient with a card with a rock on it must ask the others for the same picture. At first, the only requirement is they not point to the card, so as not to reinforce learned non-use. They are allowed to use any kind of circumlocution as long as it is verbal. If they want a card with a picture of the sun and can't find the word, they are permitted to say that thing that makes you hot in the day to get the card they want. Once they get 2 of a kind, they can discard them. The winner is the player who gets rid of his cards first. The next stage is to name the object correctly. Now they must ask a precise question such as, "Can I have the dog card?" Next, they must add the person's name and a polite remark. "Mr. Schmidt, may I please have a copy of the sun card?" Later in the training, more complex cards are used. Colors and numbers are introduced. A card with 3 blue socks and 2 rocks, for instance. At the beginning, patients are praised for accomplishing simple tasks as they progress, only for more difficult ones. The German team took on a very challenging population, patients who had had their strokes on average 8.3 years before, the very ones whom most had given up on. They studied 17 patients. 7 in a control group got conventional treatment, simply repeating words. The other 10 got constraint-induced therapy for language and had to obey the rules of the language game. 3 hours a day for 10 days, both groups spent the same number of hours, then were given standard language tests. In the 10 days of treatment, after only 32 hours, the constraint-induced therapy group had 30% increase in communication. The conventional treatment group had none. Based on his work with plasticity, Taub had discovered a number of training principles. Training is more effective if the skill closely relates to everyday life. Training should be done in increments, and work should be concentrated into a short time. A training technique Taub calls massed practice, which he has found far more effective than long-term but less frequent training. Many of these same principles are used in immersion learning of a foreign language. Many of us have taken language courses over years and not learned as much as when we went to the country and immersed ourselves in the language for a far shorter period. Our time spent with people who don't speak our native language, forcing us to speak theirs, is the constraint. Daily immersion allows us to get massed practice. Our accent suggests to others that they may have to use simpler language with us. Hence, we are incrementally challenged or shaped. Learned non-use is thwarted because our survival depends on communication.